HighBridge, the division of recorded books, presents The Impatient Dr. Lange, One Man's Fight to End the Global HIV Epidemic. By Seema Yasmin, foreword by Princess Mabel van Oranje. Read by Seema Yasmin. To Khadija, Zohra, and Yasmin for showing me that women can do everything. To Body and Soul, the young people I met at Teen Spirit, and all those living with and affected by HIV/AIDS, you have taught me how to fight and how to love. Some people, and I am one of them, hate happy ends. We feel cheated. Harm is the norm. Doom should not jam. Vladimir Nabokov, Penin. People living deeply have no fear of death. Anais Nin, The Diary of Anais Nin, Volume 2. Forward. The tragedy of Malaysia Airlines flight MH17, which was shot down in the summer of 2014, left gaping holes in the families of 298 men, women, and children. For the international AIDS community, the blow was devastating. 6 people committed to the fight against HIV/AIDS lost their lives on their way to the 20th International AIDS Conference in Melbourne, Australia. Among them were my friends, Dr. Joep Lange and his partner, Jacqueline van Tongeren, who had dedicated their lives to the fight against AIDS. Joep was a pioneer in advocating for access to HIV treatment. After the introduction of antiretroviral therapy, he spearheaded a movement to make the drugs available to everyone infected with the virus, rich and poor, regardless of where they were from. He also led the first clinical trials that showed how these drugs could prevent the spread of HIV from pregnant women to their unborn children. Joep's leadership style was fierce and honest. Joep dared to be upfront with those in power and hold them accountable for their actions or inactions against HIV. His words could make people uncomfortable, but they certainly spurred action. Those scientists and policymakers who believed that it was too expensive and too difficult to get antiretrovirals to sub-Saharan Africa were encouraged by one of Joep's now famous mantras. If we can get cold Coca-Cola and beer to every remote corner of Africa, it should not be impossible to do the same with drugs. His pragmatic approach and sometimes unexpected partnerships, such as with Heineken or the army in Tanzania, were always focused on delivering results for those most in need. HIV was more than an infectious disease to Joep. Over the years, he became acutely aware of how disease and poverty are fully interlinked. Traveling from his home in Amsterdam, Joep crisscrossed the globe, visiting health facilities around the world, from HIV clinics in Kampala to hospitals in Bangkok to community test centers in rural Nigeria. Wherever he went, Joep always took the time to learn about the realities on the ground, speak with those affected, and explore innovative solutions to increase the effectiveness of interventions. He was outraged by the suffering of those who could not afford the medications that were so easily available to his patients in the Netherlands. Joep taught us that epidemics are fueled by injustice. He was unafraid to broaden his reach beyond HIV and fight for improved access to healthcare in sub-Saharan Africa. When he established the Farm Access Foundation, his goal was to provide health insurance and medicines to the poorest of the poor. Some told him his goals were too lofty. Joep ignored them and continued to push, together with Jacqueline, for improved healthcare for all. Joep and Jacqueline's commitment to getting medicines into the hands of those who needed them has likely saved hundreds of thousands of lives. Even in death, their efforts continue. The Farm Access Foundation, the Amsterdam Institute for Global Health and Development, and the Joep Lange Institute are just some of their legacies that carry on their visionary work. Much remains to be done. Without Joep and Jacqueline's compassionate concern and leadership, we all have an obligation to step up our efforts in the fight against HIV/AIDS. Too many people are still becoming infected. Too many are still losing their lives to a preventable and treatable disease. There are many stories to be told about Yup's life as a scientist, doctor, and activist. I hope that the selection highlighted in this biography will spark a new wave of activism and inspire a new generation of scientists, doctors, policymakers, and advocates to end the AIDS epidemic. As Yup taught us, change will happen only if we make it happen. Princess Mabel van Oranje. How this book came to be. I first met Yup Lange when I was 17 and idealistic. He seemed tall and important. Stepping away from a podium at a London conference, he collected his notebook and swept a hand over his short, greying hair. He had finished giving a talk about HIV. My mum, who was a consultant to the International AIDS Society where Yup worked, gently pushed me towards him. Go on, he will talk to you, she said. I wasn't sure. I was cutting school regularly. Dumping my textbooks in the hallway of our East London flat, I would take the bus that went west from Hackney towards Great Ormond Street Hospital to volunteer at Body and Soul, an organisation that supported families and young people living with HIV and AIDS. I started working at Body and Soul when I was 14. Besides counselling young people through exams, first loves, and the nasty side effects of HIV medicines, I pushed the British government for better sexual health education in schools. While I was winning national awards for my advocacy on sexual health and HIV, my teachers were calling my mum to complain about my absences. So I didn't think Yup would talk to me. I was used to British professors with their hoity airs and graces. They looked at me through narrow eyes when I asked if I could spend time in their HIV labs. No, they said. It would take too long to train me. It was too much of a bother. Not Yup. He escaped a semicircle of scientists who had gathered around him near the podium, slipping through the crowd in the manner of a person adept at evading perfunctory chit-chat. My mum once told me that he found small talk ghastly and would press his cell phone to his ear and pretend to be on a call to avoid it at the end of meetings. But that day, he walked up to me. I want to be like you, I blurted out. I want to do a PhD and find a cure for AIDS. Yup smiled. He bent his neck, bringing his face closer to mine, and said, If you want to help people, first you need to learn how to take care of them. Go to medical school. So I did. I knew Yup was a scientist, but I hadn't realized he was a doctor. I thought doctors worked in clinics and saw patients every day. I thought they cared for individuals, not for populations. I didn't know that a doctor could save thousands of lives in one swoop by making a jab at a government official or by berating drug companies, pushing them to slash the cost of their medicines. I didn't understand those things or discover public health until I met Yup. Standing next to Yup as he told me to go to medical school was Dr. Charles Boucher, a Dutch virologist and a world expert on HIV resistance. Charles looked like a mad scientist from a comic book. He wore round spectacles, and a halo of brown curl sprouted from his head and seemed to stand on end. As Yup helped to plan my career, Charles invited me to spend a summer in his virology lab in Utrecht. For 3 glorious months, I ate pickled herring and laced petri dishes with a mouse version of the virus that causes SARS. It was in a Dutch lab that I learned to pipette and make gels, to watch as viruses outwit the drugs designed to kill them. I saw how discoveries made on a lab bench end up at a patient's bedside. I went to medical school on Yup's advice, and I wrote this book because of Charles. Yup's legacy needs to be shared, Charles said on a phone call from Amsterdam in 2016, as I packed up my house in Dallas to move to Washington, D.C. I was on my 3rd career. I'd switched from working as a hospital doctor in England to being a disease detective in the US government's Epidemic Intelligence Service, then trained as a journalist at the University of Toronto. I was working as a newspaper reporter for the Dallas Morning News and as a professor of epidemiology at the University of Texas at Dallas when Charles called. I was looking for a change. A tornado had ripped through my home the previous year while my family was inside, and while I was in Liberia, reporting on the Ebola epidemic. I planned to freelance from Washington and to begin a memoir about my life as a disease detective. I was scared to write about Yup, fearful of reducing a complicated man to a one-dimensional scientist. News stories about him read like hagiographies. I knew they were imprecise. I told Charles I would work on a book proposal, but I didn't. I left it for months. And then, standing on the porch of a log cabin at the Playa Writers' Residency in rural Oregon, watching oily muskrats glide through the water while birds skim the surface of an expansive white salt plain behind them, I appreciated that I might not be there, might not be writing a memoir about my life as a doctor, were it not for Yup. He saw ambition and drive in a 17-year-old, and instead of saying it would be hard to follow in his footsteps or that I should focus on my immediate studies, he made the impossible seem possible. Yup presumed that a girl raised by a single parent from an immigrant Muslim community, a community where girls were raised to be housewives, where few people went to university and none had been to medical school, could be a doctor. And I believed him. That short conversation transformed my life. The day Yup died, I was 2 weeks into my job at the Dallas Morning News and about to go live on CNN to discuss a front-page story I had written the previous day. It was about children as young as 6 years old crossing the border from Mexico into Texas alone, and the outraged politicians who were claiming the children were filthy and bringing diseases, even Ebola, into America. I wrote that the children were more likely to pick up infections in Texas than they were in Central America. "You're off the hook," a CNN producer told me moments before we were meant to go live. "We've got breaking news. A jetliner has crashed in the Ukraine." Then my mum phoned. Yup is on that plane. He was going to the AIDS conference in Australia. I'm so sorry, Seema. I walked quickly toward the bathroom, but didn't make it before my face was wet with tears. The newspaper's managing editor walked past and asked why pieces of tissue were stuck to my cheeks. I pointed to the television screens lining the walls of the newsroom. He put his hands over his mouth. Sitting next to Yup on Malaysia Airlines flight MH17 was Jacqueline Van Tongeren, Yup's partner in life, love, and the fight against AIDS. Jacqueline was an AIDS nurse who baffled me when I was a teenager because she had owned art galleries, danced ballet, and restored historical buildings all before she was 30. I wasn't sure how one woman could encompass so many talents. Some of her friends told me they were glad, in a way, that Jacqueline was on the plane. She would not have been able to cope without her love. They imagined the pair died how they lived, holding each other close. As a journalist, I feel bound to declare my relationship with Yup at the beginning of this book. Our meetings were brief and infrequent. Over the years, I saw Yup and Jacqueline a handful of times at AIDS conferences around the world. But despite this, and despite his schedule, hopping on and off planes, traveling continents, often missing flights, Yup wrote letters of recommendation for me, even when I was applying for opportunities way out of my league. He never questioned a driven person's ability to achieve everything. He once began a lecture addressing a room full of stodgy professors with a quote by the Queen of Hearts from Lewis Carroll's Alice in Wonderland. "Why, sometimes I've believed as many as 6 impossible things before breakfast." Journalists talk a lot about balance. I'm not sure there is such a thing. I knew Yup, and that colors my view of him. But I have strived to present a complicated man in all his complexity. Yup was kind and compassionate. He cared deeply about his patients and about confronting injustice. Yup could be difficult to work with. He raged against HIV, and that fury spilled into his relationships. He made my mum cry after a meeting of AIDS experts in Seattle because he was impatient at the progress of a project they were working on together. Nothing was ever quite fast enough. A few people I interviewed told me that long friendships with him disintegrated after quarrels over seemingly minor things. Others shared stories of astonishing tenderness and spoke of a man who eschewed ego to protect others. Jacqueline was quite different. Through more than 50 interviews and countless hours spent sifting through records, I found not one negative word uttered or written about her. She seemed to be universally adored. Interviews for this book took place in person in Amsterdam, Den Haag, Barcelona, Boston, Washington, D.C., London, Pretoria, and Cape Town, and via telephone and Skype with Jup's and Jacqueline's family, friends, and colleagues in Australia, Uganda, France, the United States, Thailand, South Africa, and Argentina. I visited Jup's childhood home in a village that no longer exists. I talked to Jup's and Jacqueline's friends and families, their colleagues from the 1980s and 1990s, as well as the people they spoke to in the days before they died. I constructed scenes from these interviews and from written records, medical journals, and recorded discussions. I interviewed experts in Dutch history and those who study the Dutch AIDS response to learn how the country's past, its religious wars and imperialist legacy, shaped a man who became a global leader in the fight against AIDS. I am grateful for those who talked through tears and shared private memories. Most of all, I'm grateful to Jup's sister, Ruit, and his only son, Max, for their generosity in sharing their brother and father. This book was written in the spring and summer of 2017, around the third anniversary of Flight MH17's crash. 298 people died that July day, among them babies and teachers, grandparents and scientists. This book is for all of them. 1. The End. The plane would crash in 6 hours, and his face would be on the news. American television anchors would mangle his Dutch name, stretching and shortening the O and the E into swooping O's and snappy A's, as they described him. Genius scientist, AIDS fighter, medical diplomat, father of 5, humanitarian, mastermind of a potential cure for HIV. Dr. Joseph Marie Albert Lange, better known as Jup, was dead. And the world wondered if the cure for HIV lay singed and scattered across a field in the Ukraine. The rebels had shot down the wrong plane. Jup, who was known for publicly cursing out fools even when those fools were presidents and Nobel Prize winners, probably muttered "stupid" and "godverdomme" in Dutch from seat 3C in Flight MH17's business class as the plane was pierced by shrapnel. A Buk ground-to-air missile fired by pro-Russian separatists had exploded near its nose. Damn those idiots fighting a bloody war with Russia. Damn the air traffic controllers for flying his plane into a war zone. Jup didn't even like Malaysia Airlines. He had racked up millions of miles on his favorite airline, KLM, as he flew around the world chasing a viral epidemic. But Malaysia Airlines flight MH17 offered the cheapest business class tickets from Amsterdam to Melbourne, where he was headed to speak at the 20th International AIDS Conference. 16,000 people waited for him in Melbourne, waited to hear the Dutch doctor with the soft voice and the words that cut like knives. Jup spoke his mind. He didn't hide behind jargon or politics. He had put his neck on the line since the very beginning of the epidemic, which coincided with the beginning of his career, by advocating for the poor and the vulnerable, taking positions his peers called fanciful and absurd. On the highest platforms at the biggest AIDS conferences, Jup disagreed with the world's top scientists and refused to settle for the status quo, a status quo that favored the white and the wealthy. He called scientists and policymakers cowards and imbeciles when they said it was too difficult to get life-saving AIDS drugs to Africans. If we can get cold Coca-Cola and beer to every remote corner of Africa, surely we can do the same with drugs, was his mantra. Yup first met AIDS in the summer of 1981. He was 26 years old, fresh out of medical school, and about to come face to face with a new and mysterious killer. The men who walked into the emergency room of his Amsterdam hospital, their bodies feverish, their eyes glassy and rimmed with blue-grey circles, were the same age as he, sometimes younger. Walking corpses collapsed onto gurneys, their bodies rattled with an infection so new to humanity that there was no primer for battling it. The virus floating through their veins, burrowing into their brains, and making its home in their glands, had jumped from monkeys to humans, morphing and mutating along the way. It attacked the immune system, the very part of the body designed to keep intruders at bay. Yup's patients were left wide open to a slew of bizarre infections that grew inside their lungs and crept beneath their skin. The young men with hollowed-out eyes coughed raspy coughs and sat in pools of diarrhea. They died slow, drawn-out deaths. There was no dignity in AIDS, only bewilderment. Young lovers were left bereft, parents were dazed. Yup rolled up his sleeves and got to work, pressing his palms into bellies, asking his young patients questions about sex and desire. He packed his bags with novels and notepads and flew to San Francisco, London, and Sydney to talk to doctors who said their patients were dying of the same plague, and there was nothing they could do to save them. AIDS was a guaranteed death sentence back then. Yup helped to change that. He ran from the ward to the lab, clutching vials of his patient's blood in his long fingers, the tails of his white coat flapping as he hurried along the corridors of the University of Amsterdam's academic medical center. This new disease couldn't be battled at the bedside alone. He needed to be at the lab bench, interrogating the virus that caused AIDS. Switching between stethoscope and microscope, Petri dishes and patients, Yup stripped HIV to its bare bones, revealing the virus's anatomy and deciphering its Achilles heel. While working on his PhD in the mid-1980s, he made seminal discoveries about HIV and AIDS. Over the next 30 years, he published close to 400 articles and saved, by some estimates, millions of lives. When Yup stepped onto the Malaysia Airlines plane on July 17, 2014, he was beside the love of his life, Jacqueline Van Tongeren, a woman who had embraced half a dozen careers before she embraced him. Jacqueline was the picture of elegance. Shiny brown hair swept her shoulders, couture frocks swished around her calves. High cheekbones and smooth skin belied her 64, soon-to-be 65 years. Jacqueline's birthday was just 9 days away. Yup would turn 60 in September. They had met on the AIDS ward of the University of Amsterdam's Academic Medical Center in 1990, when she was hired as head nurse. Jacqueline was in a relationship back then, and Yup was married to the mother of his 5 children. Eventually, their decades-long friendship bloomed into a love affair that they announced to knowing friends and family 7 years before their deaths. Jacqueline sat upright in 3A, the window seat next to Yup, her posture honed from years of dancing ballet. She eyed Malaysia Airlines' business class menu and texted her friend, Han Nefkins, that she was excited to taste the delicious Asian food that reminded her of Indonesia, where she was born. She had already emailed her brother to share some important news. The night before she boarded flight MH17, Jacqueline prepared her will. Her younger brother, Philip Flip Van Tongeren, was the executor. "I meant to call you to tell you," she wrote in an email she sent him at 1 a.m. There was another secret to share. After years of living apart, the pair had purchased a new home together, a love nest. They would move in when they got back from Melbourne in 10 days. Yup planned to write a novel there. Jacqueline hoped to use it as a base while they traveled around the world, spending month-long stints in their dream destinations. Of course, they would never stop battling the HIV epidemic. They had seen up close how a virus could creep into bodies and destroy white blood cells, and then jump across borders and crush economies. Now the air above a Ukrainian village was choked with smoke and regret. Guidebooks to the Australian outback turned to cinder. The faces of koala bears crumpled and burned. Travel toothbrushes melted into plastic puddles among stalks of scorched, yellow grass. The wrecked body of the plane lay strewn across the field, jagged pieces of its belly and tail still smouldering. Every person on board was dead. 298 Australians, Indonesians, Malaysians, Brits, Dutch, Germans, Belgians, Filipinos, with one American, one Canadian, and one New Zealander. Among the dead, 3 babies, 77 children, a nun, a helicopter pilot, 5 AIDS researchers, an Australian couple who lost their son and daughter-in-law on another Malaysia Airlines plane, flight MH370, when it disappeared in March that year, lost their granddaughter on flight MH17. Bodies rained down over houses and fields. Their limbs and lives became bargaining chips for pro-Russian separatists. But death was still 6 hours away. It was a cool summer morning in Amsterdam, and Jacqueline was crouching on the floor of her apartment, cramming Missoni skirts and Comme des Garçons blouses into a suitcase already stuffed with shoes. She texted her best friend, Peggy Van Leeuwen, "I'm like the Imelda Marcos of Holland." Joep was shooting off a sarcastic email to one of his staffers, squeezing medical journals and 3 novels into a laptop bag to read on the plane, then looping a leash around his diabetic Irish Terrier's neck. He stroked Lizzie's soft grey fur. They stepped onto Beethovenstraat, the Tony street he lived on with his children, for a stroll before the long flight. The air was fresh. Lizzie was weaving in and out of his legs. He waved at a friend driving past them. 2. Origin Stories. It was a breezy morning in August 1961 when a teenaged boy stepped onto a merchant ship in the Oslo Fjord docks in Norway. Arnie Vidar Rød had just turned 15 and earned a job as a kitchen hand aboard the Hög Arundi, a 4,000-ton cargo ship. It was Arnie's first day as a sailor. What could be more thrilling to a teenage boy than leaving behind the frosty waters of Scandinavia and floating toward the warm waves of the Gulf of Guinea? Ship life bore its own tedium. Restless from months marooned on the metal vessel with only men for companionship, Arnie was ready for adventure. He stepped off the ship in Douala, Cameroon's largest city, and found it heaving with the traffic of hard-working people, fishermen, shipmakers, farmers, people who use the strength of their bodies to make a living. Ramshackle bars wafted sweat and the sounds of bikutsi music through the streets. Arnie knocked back beer and stomped his feet with a new friend who taught him how to thrust his hips in time to the beat. When he boarded the ship days later, he carried with him a souvenir from that night. It was gonorrhea, the first of 3 sexually transmitted infections he acquired on his virgin voyage. Arnie sailed north with his new microbial companion, stepping ashore at ports in Nigeria, Ghana, Côte d'Ivoire, Liberia, Guinea, and Senegal. It would be 10 months before he returned home to Norway, another 4 years before a nameless parasite inside his veins would flow to the surface. In the meantime, with his infectious memento still buried deep inside him, the merchant seaman sailed to Canada, the Caribbean, Asia, and Europe. Besides a 2-day stop in Mombasa, Kenya in the mid-1960s, Arnie never returned to Africa. In 1965, Arnie settled down in Oslo, married and had a baby girl. By the time his second daughter was born in 1966, the young father's joints were swollen and hot, his chest was tight and congested, and his muscles ached deeply. The glands beneath Arnie's jaw were tender, throbbing knots. Angry lumps poked out along the creases of his groin and in his armpits. Crops of red blisters dotted his chest and back. Arnie's doctors were baffled. In an Oslo clinic, they listed the young man.
Sample complete. Ready to continue?